Hi everybody, and welcome to Rapping with the Rep. These are the COVID-19 series of shows that we're doing to update you on the changing conditions of our government in its reaction to the current health crisis. While we are not en masse at the State House, the building is closed and many of the non-essential workers are not there. Your representatives and senators, such as myself, are continuing to work from home and continuing to do what we can to improve the lives of our residents while at the same time addressing the health crisis that confronts us. What I'll be doing on a regular basis, if not daily, then every other day, is taping a series of updates from my home, because like you, I will be staying at home to the extent I possibly can. So from there, I'll be giving you information on the latest news, on the latest issues that we're confronting. I'm going to start off each time with a short 2-minute clip from the CDC to remind everyone what you should be doing in this time of crisis, how important it is to keep your social distance, to wash, etc. And then we'll be right back at the end of this 2-minute clip to talk about the latest developments. Thank you very much.
Hi, I'm Dr. Jay Butler, Deputy Director for Infectious Diseases at CDC. I'd like to talk to you about the new virus that causes the disease COVID-19. Older adults and people who have severe chronic medical conditions like heart, lung, or kidney disease, or diabetes may be at higher risk for severe illness from COVID-19. If you are one of the people at increased risk for serious COVID-19 illness, it's especially important for you to take action to reduce the risk of getting COVID-19 now. The first thing you can do is take care of your own health. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available. Cover your coughs or sneezes with a tissue, or cough or sneeze into your elbow, not your hands. Avoid contact with people who are sick. Clean and disinfect surfaces in your home, such as counters, tabletops, and doorknobs to remove germs. Use household cleaning sprays or wipes according to the label instructions. The next thing you can do is make a plan for what to do if you do get sick. Know who will take care of you if your caregiver gets sick. Talk to your healthcare provider about getting extra necessary medications to have on hand. Get enough supplies too, including enough household items and groceries so you can stay home for a few weeks if you have to. The third thing you can do is pay attention to what's happening locally. If COVID-19 is spreading in your community, stay home as much as possible and avoid crowds. If you get sick with fever, cough, or shortness of breath, call your healthcare provider. If you develop warning signs, such as difficulty breathing, persistent pain or pressure in your chest, confusion, or blueness of the lips or face, these may be signs of serious illness. Call 911. For more information and the latest resources, please visit cdc.gov/COVID-19 or call 1-800-CDC-INFO. That's 1-800-232-4636.
Hi everybody, welcome to an update of Rapping with the Rep. I'm State Representative Ken Gordon, and I hope that we're all healthy and safe during this very challenging time. We're all doing our part to address the current crisis caused by the pandemic known as COVID-19. I read something on the internet just yesterday, and I think it puts what we're doing into perspective, and what it talks about is the role of medical professionals to engage in the research that they need to do in order to create a vaccine that's eventually going to put a stop to this coronavirus, this COVID-19 virus specifically. Until then, it will remain as a threat to us. What we're doing in engaging in this physical distancing, in staying home from the activities that we enjoy normally and that are part of
the productive day of our lives, like going to work, usually. What we're doing now is giving them time. And that's why it's so important. Because if, while they're working on this, we continue to assemble together, to be together, then this virus will be able to travel from person to person and infect more people, some of them fatally, some of them lethally. Most of them, not so much, but certainly we are going to continue to value every life in this Commonwealth and do our part to address these issues. Certainly it's causing an effect to our economy, and certainly we're going to take measures to try to minimize that effect on our economy. But at the same time, we're going to protect our safety and we're going to protect our health. Now, to that end, as of yesterday, in fact, yesterday, the number of positive cases in Massachusetts rose by 679 to 1,838. Now, that sounds startling because it sounds like it rose triple in one day. That's not exactly what happened. What happened is we're engaging now in more testing than we've ever done before. And because we're testing more people, we're finding more positive results. And so it's sort of a curve in that way. So I don't be alarmed in the numbers rising quickly. We're just getting more information. And so we're seeing that this was present all along. These numbers were high all along. In fact, almost 20,000 patients have been tested so far. Today, by the way, is March 26th. And it's important that you keep in mind that this recording is being made on March 26th. If you're watching this on the 27th or the 28th or the 29th, certainly this data has changed. But some of the information in this video probably has been superseded by other information because things have been coming out so quickly. And I'm going to try to keep up at least every other day with updates here from my home, where you see I don't have the normal background of Rapping with the Rep. Now, the most up-to-date data, the most recent data that we know, in fact, the most recent information we know, was that the governor was on TV with a press conference yesterday. And what he announced was that schools would remain closed now until May 4th, the first Monday in May. So the school closure order extends almost an additional month. Now, the school departments in our area, Bedford, Burlington, and Wilmington, have been preparing for this for quite some time. Up until now, the guidance they have received from DESE, the Department of Elementary and Secondary Education, has been to offer what we call enrichment programs, which is voluntary educational opportunities for our students who can engage in these things. But we know that not everybody has access to online learning. Not everybody has access to learning in the same way in the first place. And we want to give everybody the same chance. And so for that reason, the programs haven't been overseen as strictly as they otherwise may have been. But we're now going to be entering a new phase of engaged learning. And parents with school-age children are going to begin to get more and more communication about exercises, lessons such as it is, that your kids can participate in. And so you'll be hearing from that directly, but so that our community knows that this isn't, as the governor says, this isn't an extended summer vacation by any means. Our kids will be given instruction, our parents will be given more instruction as to how we're going to go from this enrichment to active learning. The other announcement that was made yesterday that will affect all of us will be the suspension of the plastic bag ban. There we go. The suspension of the plastic bag ban that was in effect for Wilmington, for Bedford, and for Burlington up until now. This is an emergency situation. I certainly support our environment. I certainly understand why the banning of plastic bags was an advantage to each of our communities and why our communities voted to do that. But in this situation where we're in crisis, the issue with the reusable bags, which are now not going to be accepted at our supermarkets, is that we just can't control where the bags have been. And so therefore they put the supermarket workers at a health risk. And so from now going forward until further notice, just please keep the reusable bags at home, and the plastic bags will return. Paper bags certainly have always been there, but there will be no charge for either the plastic or the paper bags in the supermarket. Just a word of respect for the people in our supermarkets. When you go in, please be mindful of the 6-foot distancing um, instruction that we've been given. Again, if we can do that, if we can slow the spread of this virus, we give ourselves a chance to catch up medically. That's very important. And so when I've been in the supermarkets, I have seen shoppers just approaching each other in the aisleway. Of course, we're going to do that. Hopefully we're not going to have a rule that says only one person in each aisle, but you never know where we're headed with this. But until and unless that happens, if you see someone, just give them a little wider berth out of respect for each other and ourselves. And that goes for the workers in the supermarkets. They're out there confronting communication with the public. So please just step back a little bit and talk and engage that way. And then a word about our restaurants. Our district was one in which, the towns in our district were one in which our daytime population was a lot greater than our nighttime population. People come in to Bedford, to Burlington, to Wilmington to work. And the restaurants were set up because there was such a demand from employees who were not at home. But many of those employees are now not at work. And so these restaurants have found that their customer base has been cut drastically. Many of them are restaurants that have supported our community for a long time. When we have high school plays, when we have religious fundraising activities, when we have other things, oftentimes it's these types of businesses that have helped us. And now I think the call goes out for us to help them. And so if you can keep that in mind and think about them, not every day, but every few days when it's mealtime and you want to sort of treat yourself to a restaurant meal, remember they're still open. They're still making the same delicious food they've made for us for a long time. Remember that they're very clean. They're inspected at least twice a year by the Board of Health. They are mindful of their responsibility to be sanitary. They're wearing gloves. They're doing all those things because they're used to that. And they're going to continue to respect that. So please keep that in mind, and please tip the staff when they deliver your meals as if you were eating it in, because remember that they're really hurting. I've got a bill that I filed, and the governor filed a similar bill. In fact, the Senate filed another that will allow for the restaurants to serve closed bottled beer and wine with the delivery of a meal. I expect that this could pass very soon, and in some form it'll be negotiated between these three bills. And also we've brought in the interested parties to do that. So you'll see the opportunity when you pick up a meal to be able to pick up a bottle of wine or a few bottles of beer. They'll be closed, and they'll be priced not I guess I'm predicting this, but we're allowing them to price this the alcohol in a way that helps them to sell it, because of course the liquor stores will remain open. So don't assume that the restaurant prices are there. Other things that are going on, if you have if you're challenged to pay the rent, or if you're challenged to pay your mortgage because of the loss of a job due to this emergency, please call our office. There are programs that we are commencing right now on an emergency basis to help people who are renters and to help people who may have trouble with mortgages. See if you qualify. Call us up. I think at the bottom of this, we can put my office number. Please give us a call. And speaking, I'm sorry, I'm leaning forward to look at some notes I took to make sure I don't forget to tell you anything. But this is also important. That I think many of you know that I schedule office hours several times a month in Burlington and Bedford, and then a few once every few months in Wilmington at the Council on Aging and at a coffee shop. We won't be able to gather in person to do that this month or next month, and so I'm going to organize either telephone or video call-ins to replace those office hours. And the first is this afternoon. So today is Thursday, the 26th, and we'll have a conference call in from 2 to 3 o'clock today. I think we can run the phone numbers at the bottom of the screen, but it is the phone number is 617-570-0800. Sorry, I'm looking off screen, but I'm reading the number myself. And then you enter the conference ID number 810 followed by pound, and then you enter the participant passcode 810326 followed by pound. Anyone in the district, Bedford, Burlington, or Precinct 3 in Wilmington, please join the call. And if you can't get in, you can call my office, 617-722-2575. Next thing I want to talk about is testing. As I said early in the update, the reason that we're finding more positive test results is because we're doing more tests. And that's a good thing. I'm really proud that the Bedford Research Foundation is joining the team of small labs, of private labs, not many are small, but they are engaging in testing and doing their part. I'm going to have a more detailed story about what they've been able to do, and I'm really proud that I was able to kind of make the connection to the state program and to the Bedford Research Foundation to be able to do that. But remember that this company right here in our district is doing its part to engage in the testing that we need to protect ourselves. Remember that testing not only protects the person who's suffering from the virus, but knowing that they have the virus is important as a matter of public health to the rest of us. Let's see, what else have we got to talk about today? Many of you have been asking about the state tax deadline, which is still the 15th of April. And we're working on it. We've contacted the administration to ask them on an expedited basis to change that deadline. The issue isn't that they don't realize that the deadline is now different from the federal deadline to file your taxes. The issue is simply how are we going to deal with the delay in some of the funding that we need in order to fund these very programs, these very emergency programs that we're talking about. We'll get it done. We just have to figure out the right way to get it done. All right, so those are the updates, the significant updates for today. I will be doing these every few days. Please check back with Rappin with the Rep. Thank you for your attention on this, and please be safe, be healthy, and do your part. Respect social distancing and stay home when you can. Thank you.